Hello and welcome. We're so glad to see so many of you joining us today for part 2 of our 2026 year-long Bend the Trend webinar series. You are officially part of the movement, and if you missed part 1, have no fear, you can catch up via our YouTube channel. The link is in the resource box on your screen, which I'll reference a few times throughout today. We all know that lowering healthcare costs doesn't happen overnight, and it doesn't happen alone. This series is about learning together and taking action along the way, learning from each other. Every session builds towards a bigger picture, and we can't wait to share how it all connects when we meet in person at our spring symposium. So stick with us, it'll be worth it. Last month, our focus was on preventive care. I cannot stress enough how important it is to take care of the little things before they become the big things. At the end of that program, we asked what action you, our employer members, plan to test out with your own group. And here's what you told us. 45% had planned to promote preventive screening in your communications. Almost 20% were going to talk about prevention at a leadership or team meeting. Another 10% were willing to offer an incentive or reminder for an annual checkup. And 14% plan to offer training on how to access preventive services and focus on the access component. Another 12% were still in planning mode, but we loved seeing almost 90% of you willing to take action coming out of that meeting. It was such a great start. With that said, for those of you that attended that session, I'd love to know now what you tried. How did it go? In a few words, tell us what you did in the comments section. Of course, don't be shy. There are no wrong answers. And this is what we're here to do, engage and share thoughts with each other. T-shirt weather is definitely a solid preventive care mental health comment. Just joking around. Keep sharing your thoughts. We'll learn from each other. Engaging throughout the session today will be helpful for everyone. We do have a really large group today. While you were experimenting, so were we, because we're not going to ask you to do something that we're not willing to test ourselves. Here's what we tested. We talked about preventive screenings at our monthly all-staff meetings. The goal is to normalize the conversation. We had a few members of our leadership team and employees share where they completed their annual physicals, and talked about screenings. We sent an email to staff providing updated timing information on the importance of preventive care and when you should get those screenings. As a side note, we had that email come from a non-normal channel. It was not our standard benefit email, just to see if that increased engagement. And then we shared a link to our Find a Doctor tool. Here's what we learned internally. Employees did respond and shared some success stories about Tier 1. We had just a few questions come through, and we increased awareness. Sharing my own story, we were sending out the email on timing, and I learned that the timing for one of the screenings had changed, and I was actually overdue, so lesson learned. Even those that are in this every day can always learn from the information. Our immediate response was small, but our hope is that we at least planted a seed to help our employees feel informed when they do need to make their own decisions and build it as part of our norm within our team. We know that change takes time and it's still early in the process. We also plan to revisit our data later this year to see if we can see a noticeable change in what comes through after there's some time for all of these discussions that we're having. Of course, this is a movement, and movements gain momentum when we're transparent, we share our successes and our challenges. And again, I'd encourage all of you to do that with us today. Hello, everyone. I'm Melanie Shinneman, Vice President of Business Growth and Member Strategy here at the Alliance, where we partner with employers to self-fund smart. Today, we're asking what would happen if we made simple changes to our benefit plan. Could small shifts really give us more control over our healthcare costs? So here's what we're going to focus on today. First, we'll identify the hidden costs of sticking with the status quo. Could all argue status quo isn't working today. See how applying small benefit design changes can make accessing care easier. And then we'll assess how well these strategies can work to improve outcomes and lower costs. Before we get started, I want to thank our sponsors, National Cooperative RX, MH Imaging, and Checkups by Pathfinder Health are part of the movement. They're in the trenches working with us and trying to shift our industry. Their support allows us to continue bringing events like this, employer-focused programs to you. You can learn more about each one of those sponsors and how they are providing tools and resources by using the links in the resources box on your screen that I mentioned earlier. So as I mentioned, this webinar is part of our year-long movement to bend the trend, and it's not about making things perfect or about offering quick fixes. Unfortunately, I don't have that quick answer for you today. It is about trying small things, testing one new idea, or turning any idea into an action. What makes this series different is that we're not just presenting ideas and regurgitating information. We're putting these ideas into practice in our own organization and sharing those lessons learned with you throughout the year and encouraging you to share amongst each other. Today, we're focusing on benefit plan design, but before we talk about solutions, we need to talk about costs because the biggest expenses in healthcare rarely show up overnight. It's the missed screenings. It's the employees going to urgent care or ER because it's easier and what they know, what they've been taught to do. Or even worse, it's the employees delaying care completely until they're forced to deal with it for whatever reason. All of those things add up to big costs over time. And I would argue that is unsustainable. If this sounds familiar to you, you can't afford to keep things as they are. There is a cost to sticking with the status quo. And unfortunately, inaction is action. So let's take a quick poll before we jump in to see where everyone on today's call is at on this journey. I really encourage your participation for these insights. It helps us tailor the rest of the conversation with our speakers today. What drives costs in your organization? Is it benefit plan design issue? Is it a communication issue? Is it both, or is it something more? Feel free to add any comments in the chat if you think it's outside of that. And we'll wait for a few answers to come in. Of course, many of these are connected, so I'm curious to see where everyone in this audience fits in this journey. Answers are coming in quickly. Just give it a few more seconds and make sure everyone can navigate. Great comments. High cost claims, definitely something that we were talking about earlier. All right, interesting. We have 35% of you showing that it is a communication issue, and about 20% thinking that it is a benefit design issue. Many of these things go hand in hand. So I think we have some great content specifically for that. I will read through some of the main chat comments as well and see, hopefully we address some of those with our content today. As a reminder, if you're an employer member of the Alliance, lean on us. We can support you with the benefit design questions, the analytics behind the scenes. If you would like that help, there's a QR code on the screen or an option to click schedule a meeting in the link in your resource box. So before we dive in, remember you can't manage what you can't measure. Use data as a guide to find your missed opportunities. A few good places to start. Your top 10 highest claims for the year. We've mentioned that in our chat already. Your top 10 categories for the year. Employee surveys, getting information, or your pharmacy spend. When we looked at our own data, what surprised us wasn't just the dollar amounts that many of you have referenced in the chats, but how much of our data tied back to delayed care or just confusion about the benefits. Folks that were new to the plan, people not knowing where to go to get early care. We know that we couldn't fix everything in one swoop. So what we're choosing to focus on are two key areas: preventive care, which we have mentioned, and coming out of that deferred, skipped preventive care screening that many of us saw over the last 5 years, and really just making things more simple for everyone on our plan. Our goal is to remove barriers. We want the benefits to be easier to access. You don't need to commit to a major overhaul, and that is one of the big takeaways today. Just test one small thing. Try a pilot with one program or one department. Try one screening, one communication tweak, or adjusting care navigation, make an improvement. We also would mention pilots are powerful in the right setting with the right group or the right benefit because they're easy to learn from. They're reversible, and you can always pivot from what you're learning and scale from there. At this time, I'd like to ask our panel to join us to evaluate and share their own real-world stories to let us know what strategies have worked for them, and of course, which have not. With me today are Jennifer Burris, Assistant Vice President of Total Rewards and People Technology at UW Credit Union, and Jamie Kruger, Director of Human Resources for Crystal Finishing Systems. Welcome, and thank you both so much for taking the time to meet with us today. Thanks on behalf of all of our employer members joining us. There's a lot that we can talk about when it comes to benefit plan design. You are both in different types of work environments. So Jamie, let's start with you. Can you tell us a little bit about your organization first?
Yeah, absolutely. So we have roughly 980 team members at 4 different locations. 3 of those are in Wisconsin, and 1 of those is in Mississippi. We also have about 150 of our team members in totality are salaried team members. The rest are hourly. So it's really the nuts and bolts of our organization, our hourly team members to support those.
Great. When you looked at your own plan, what cost drivers stood out? And what helped you determine where the best place was to start?
Yeah, absolutely. So the first place we really noticed there was a gap was our prescription spend. Prescription spend was certainly high, and our ER utilization was very high as well. We really needed our team members to better understand their prescription benefits. So we started to really work with our on-site clinic a little bit more closely to understand where are we spending those, what does that spend look like, and are some of those necessary? We work with our broker that helps push back and say, are we focusing on the right things as far as care with our team members? We also have wellness coaches that we utilize that we're working with to develop programming so they can come on site to our clinic, to our locations, and talk to our team members about prevention and the importance of wellness in their day-to-day life to hopefully, in turn, have healthier, happier team members to drive those prescription costs down. I think some of that is a lifestyle intervention as well that our wellness coaches really do a great job talking to our team members about. I think complacency sometimes is something that I know I personally struggle with, so it's great to have those resources. We're currently working on it. Really, it's a multifaceted approach. We're working with our on-site clinic to get out magnets for our team members to understand know where to go. So Know Where to Go campaign is something that we've been working on in HR since the beginning of this year, is really pushing that education and knowledge, like what really is an ER visit versus I can wait to go to the clinic tomorrow, or maybe it's urgent care or some other avenue other than ER. So it's really trying to figure out how do we educate our team members in conjunction with our on-site healthcare partner to really work with them so they know where to go for care.
That's such a great focus. Communication was one of the top things mentioned in our poll earlier, so that's great. Thank you. Jennifer, you're at UW Credit Union. What does your workforce look like? And then we'll ask you the same question.
So we have about 900 employees spread out amongst nearly 40 locations, all in Wisconsin. And obviously we're a credit union, so we have branches. About half of our employees are in more of a traditional corporate setting, but the other half is in a branch, and they're sitting at terminals that have member data and interacting with our members all day. So they're not behind their own email all day. They're not looking at our intranet all day. And in this way, we face some of the same challenges that Jamie does at her work about really trying to reach them to better educate them about our benefits. We do still provide a lot of educational information via those traditional email and intranet resources, But then we have screens at every one of our locations where we post short videos and also slides about our benefit programs. And then sometimes we do also send postcards home to our employees so that we can also connect with their family members who might be on our plan. And we have a benefits microsite that is accessible outside our network. And that's been great to be able to reach our family members as well. And then for us, the cost that stood out, I would say a lot of similarities to what Jamie said and also what I'm seeing in the chat, the high cost claimants and also the prescription costs. Those have been growing out of control for years now. And moving to a self-insured model for us has been fantastic because we finally have the data to really be able to better understand what is driving those costs and what our employees are really experiencing so that we can focus on influencing some behavioral change that'll be really meaningful there. So I think the key for us that we have learned is that we have to take in that data, we have to digest it, and then we have to be flexible about what we do with it and how we really respond to it. So for example, in 2024, we switched PBMs. And that was something that wasn't really visible to our employees. And so it wasn't overly disruptive, but it really helped the plan from a cost perspective. Then we also introduced a program called Prudent RX to, again, help with those specialty medication costs. And really, that's provided significant savings back to our plan, which has been great. Similar to what Jamie said, we have a new wellness vendor in place this year. We've got a 3-year strategy in place where we're morphing our incentives over time to be outcomes-based and really to be able to develop and tailor programs that address the issues that our employees are going through and really improve their health outcomes over time. And the educational component is huge. You know, incentives are a great way to influence behavior, but people have to really understand what they are and what those behaviors are and what they need to make changes to. So that is critical for us to communicate frequently and also kind of in small digestible doses to our employees so that they better understand how to utilize their benefits.
Such great examples. Thank you so much. 2 things that I'm hearing both of you highlight on. It isn't just communication, it's teaching through your communication. And also with the multi-channels, it's small, digestible, I'll use your words, Jennifer, small, digestible information. We're trying to get them what they need in that short window of time. We know we have their attention span for that short window. Great examples. Jamie, of the small benefit design changes you've tested, which one gave you an early win that prompted you to continue?
Yeah, absolutely. So I think, while it's not small, but definitely making the transition to on-site healthcare really has helped us drive and keep our costs down. I mean, we provide it at no cost to our covered team members and their dependents and spouses on the plan. So it's really been a game changer for us in understanding our costs and how to help our team members a little bit better. They really do a nice job helping us understand what services that we need so we can help those in-house. So we're talking about, hey, what are the things that the patients are asking for when they're coming in? How can we better support that? What does that service look like? So we're constantly having these collaborative conversations. The clinic provides CT scans, MRIs, X-rays, ultrasounds, vaccinations, just a myriad of awesome services for our team members to take advantage of. And that's really helped mitigate our cost as an employer. While there is a fee on the employer end, it definitely has helped us mitigate some of those things as well. And again, I'm going to go back to what we've already talked about is that education piece. The educating our team members is so critical to ensure that they're using that plan correctly. So not only do we have that on-site option, we also have tier 1 providers that we're steering our team members to that again gives us better discounts, but then we're also leveraging that to be able to offer some cash incentives for our team members that if they're taking that tier 1 option, maybe they do have to drive to Minnesota for a procedure, but hey, we're going to pay them $700, right? So that would cover their stay. So, I mean, while it seems like it's kind of grandiose to cover those different ancillary benefits, it really is a game changer when it comes to cost savings.
Great examples. It's catching the attention for sure. Jennifer, what small design changes have worked for you?
Well, you're going to hear a similar theme here because we have had a care and navigation partner in place for a few years, but we were able to make a change recently to not only have the care navigation partner in place, but also to put incentives in place. So if employees have the option, if they shop through our high deductible plan as well as our copay plan, if they shop, they're given a good, better, best option. And the better and best, if they utilize one of those and submit their EOB, they get some of that savings back in a payroll bonus. And so that is huge. We all know with high deductible plans, the big push was consumerism. And there was just a flaw in the plan because there was no way employees could be good consumers without transparency. So that care navigation partner and the education around the importance of using that care navigation partner to shop before they take advantage of any services has really been key. Back to that idea of the status quo, we've all been very used to going to your provider and your provider says you need X treatment or X image. And by the way, here's the referral to go to the person down the hall. Great, you go. You don't really think about it. And now we're encouraging our employees to take that pause and say, wait a minute, I need to make a phone call first. I need to make sure that that is the best possible provider and the best cost provider for me to be able to go to. And it's really that education around not only what is best for you, but also your choices impact the plan. And so really understanding that if you shop and you take advantage of these still very high quality, but lower cost providers, it saves you money and it also saves the plan money. So that has been huge. Another change we made just this year with some of the regulatory changes through Teladoc, we were able to offer the same low copay for our high deductible and our copay participants to be able to utilize Teladoc services. And so that is just another way for people to access quicker care that is still high quality for a lower price.
Great example. And what I'm hearing both of you say is offering benefits that allow people to manage their health. So it's health care, not just sick care. Such good examples. Speaking of status quo, Jennifer mentioned status quo and trying to move away from the norm. People often prefer to stick with status quo, even if it costs them more. How do you overcome that?
Yeah, I think the first step is just understanding that change is an evolution. It's not going to happen overnight, right? I don't have a wall phone at home, and that happened over time, right? You have to build that trust. And that's the same thing, in healthcare and building that trust, right? So it's really starting by building relationships with our care team. So it's the on-site clinic, having good relationships with them. We have a monthly meeting where we get together and we talk about prevalent issues for our team members and things they're seeing in the clinic. We welcome our doctors and our care teams into our break rooms. So the wellness coaches are actually going out on the floor, talking with our team members. We have members of the medical team going out on the floor, helping people sign up for immunizations or doing pushes, or they bring popsicles out just to engage with our team members, right? To make sure they're breaking down those barriers. Health is a really difficult thing to understand because it's so personal, right? It's your heart and your mind. So building those relationships, I think, is really key to that change process. It's that interaction. We have hosted open houses, so our team members can have that, hey, I'm going to go into the clinic, see what it's about. Again, building that trust. But yeah, we incentivize them. They could win some prizes, right, by participating. But we've had really great success with that, with over 600 participants doing that. So, it's been really, it's been eye-opening to really work on building that relationships. We have a saying internally that we go back to basics, right? It's the basic pieces of healthcare that sometimes we miss. I think particularly me, we work in this fast-paced world where everything had to be done yesterday. And I think healthcare is one of those things, particularly when you're trying to change that status quo, that you take the time to tell the story. Let the story develop and listen to your team members. So you're not going to be perfect. In our transition to this, we haven't been perfect with change. Desire is the hardest part of any change. And, I think in particular, we maybe rushed some changes in reflection looking back. and I think that's critical to a part of moving forward is you're not going to get it right the first time. We're going to have to probably tweak some things as we go, but recognize that it's about building a trusting relationship. I think that's the key piece of any shift.
That's great. Is there any specific evidence that showed you the changes that you've implemented are working? Anything that jumps out to you?
Yeah, I mean, we've seen, about a 10% increase in our health risk assessments that were completed. So that's really great. I think again, it goes back to building trust, and my full belief in HR is our job is to do things with you and for you, not to you. So I think that that's really important to remember that, and just building that trust. We track touch bases we have with our team members, and we've seen a sharp incline of that both on the benefit side as well as our HR business partner side as well. So we're seeing the engagement from our team members. They're talking about their benefits. They're talking about healthcare. Even if it's not positive, they're talking about it. And I love that because it gives us an opportunity to do something better. So really our metrics of our touch bases with our team members have skyrocketed in regards to this topic. So, I mean, absolutely.
Great. I mean, even just anecdotally, employees talking about it amongst themselves as evidence on its own. That's great. This next question is for either of you. What change or strategy gave you the biggest return for the least amount of effort? Of course, I couldn't promise any easy buttons, but thought we would ask that question.
I'm happy to chime in here. So one of our big changes was something that was not necessarily super visible to employees. I mean, they certainly knew it, but our move to our PBM with different rebates really helped us financially. It helped the overall plan costs. Certainly employees, there was some disruption, but it was quite minimal. And that was something that we saw a huge bang for our buck. Another thing that was really important for us and had a huge impact, and it's not necessarily small, but we had for several years, we only offered a high deductible plan option. And last year we offered a copay plan as well. And I really believe employee choice is critical, and our employees told us that. Even though we had actually small migration over to that copay plan, because our employees really realized the value of the health savings account and also the employer contribution that we make to it, they absolutely appreciated the option to have choice and to be able to make a thoughtful decision about what benefit plans they had for themselves, how they utilize those benefits. And for those employees whose primary thing was being able to have predictable expenses, the copay plan was huge. So that was a really good reintroduction. We had previously had a couple of plan options. So our employees appreciate having that ability. And the other thing too is that our employees really just, we have learned through a survey that our broker helped us give to our employees, that they really place more value on the benefits that they obviously understand the best. Those are the benefit programs that they're really going to appreciate. And so being able to better tailor our education, that came into play when we did offer up the copay plan. Here are the differences in our plans and how they work and what the costs are to you. And so that was something that was really broadly appreciated by our employees.
Such a great call out. I think whether they're ranked first or second, with healthcare being personal that we mentioned earlier, finances are equally as personal. So allowing the choice for employees, way to listen to them and let them make the decision. Jamie, is there anything that you wanted to add from a biggest return for the least amount of effort?
Yeah, absolutely. I think for us, I mean, Jennifer hit it on the head, but I also will add educating not just the team member, but the family. I think that family education is super important, particularly in the manufacturing field. We're heavily male dominated. So getting materials home has seemed to really been a big win for us. We often now are getting calls from spouses, which is really great. So they're reading the materials that are being sent home. It doesn't have to be grandiose. I mean, we do a quarterly company newsletter that we offer information in, but we also send postcards and things of that nature, that for a minimal amount of effort and spend, it's really been a big bang for our buck.
Great. We know that change can be hard, so chunking things into smaller, more manageable tasks is part of the process. Jamie, have you tried pilots before or scaling things before you do a larger launch?
Yeah, I kind of chuckle a little bit because I wish we would have, right? Hindsight is 2020. I think in particular with us and what we saw with our population, we did too much too fast. Our requirements to get some discount, some different rates for our team members doing the high deductible plan, really, we really kind of missed the ball a little bit. So what I would have loved to do is slow down a little bit when we talk about biometrics and HRAs. So I guess my advice would be anybody that's pursuing that, start slow and then build. It's scary, right? Knowing your numbers is really powerful, but it's also scary to a lot of our population because they may not have had to do that before. So understanding, and when you're making that transition, I think I would have loved to slow that down a little bit. So now we're scaling it back and making it a little bit more palatable, but I think sometimes we can come off too strong too fast. So I think that we need to pilot more in our organization, in particular with these things. If I think about it, we do it well from a manufacturing side with a new product. So why wouldn't we do it with things such as benefits? So definitely lesson learned for us. We can always, everything's figure outable and we can go back and redo things. But if I were to do it again, I think that understanding people's adaptability to change definitely needs to come into account with these things and start slow and then build from there.
Great. Great advice for those on the call. One pilot example I have seen successful is very specific to communication. In one place that I worked, we tested out a pharmacy communication. It was incredibly important. It was a chronic condition letter with a call to action. And the pharmacy team tried out 2 different letters to see and tracked the results, which one garnered the most responses. And they did that for a subset of that specific condition and used the most effective one for the larger audience. And then actually they used similar wording in future correspondence when they didn't have the luxury of timing, to your point. But the ways that pilots come forward, there can be several different examples. All right. So, Jamie, you mentioned that you wish you would have done one. Is there a strategy that you've tried and failed? And is there any other lessons learned that you would encourage employers to look out for?
Yeah, I think just with us, we just did too much too fast. So I would just encourage, there's a whole bunch of change methodology, and if you're not using it in your organization, look up whatever, search the internet. There's a lot of things that come up, but simple change methodology, I think, can help any organization when going through a change, because really there's beauty behind what we're doing here, right? This call to action, this movement, how we're looking at healthcare. There's a lot of really great benefits from it, not only from the employer side, but for our team members as well. So I think sometimes that can get lost if we just worry about executing on dates and timelines and all of those things. There's people behind the change. So for me, any successful change that I've done has involved remembering that there's hearts and minds involved with this decision, and we have to treat people like people through this process. And we're going to have to hold hands, and we're going to have tough conversations, and we're going to have to say the same things 30 times, and it's okay, as long as our team members understand at the end of the day, because that's where they're going to see the true benefit of plan design.
I don't know if 30 times is an exaggeration. I think we've all been in the spot where that feels accurate. And some great comments in the chat. Start slow and build. Get the information to employees in the way they want to receive it, and be willing to do it a 31st time. This final question, well, actually, before I jump into that question, Jennifer, is there anything that you want to add there? Are there any strategies that you've tried and failed, or that you'd encourage employers to look out for?
Yeah, great question. And again, I'm going to be pretty consistent with the messaging we've already heard. I would say where we've realized in hindsight that we failed and we could have done more is when we moved from a fully insured HMO over to self-insurance. And where I think we failed is really in educating people on what that means to them and how their behaviors would be impacted. And again, to Jamie's point, these are humans trying to utilize our programs to the best of their ability to help keep them as healthy as possible. And one of the biggest messages with self-insurance is really moving from a me focus to a we focus. And by that, I mean that their behavior not only impacts their own out-of-pocket costs, but also the plan costs. So we all know that high cost claimants, for example, are a huge expense. Sometimes those folks might think, okay, I've already met my deductible. I may even have met my out-of-pocket. I'm just going to go to the ER now whenever anything comes up. And it's a matter of educating people there. No, you still utilize the ER only in certain instances. But otherwise, even though it doesn't impact your bottom line because you've hit your maxes, it still impacts the bottom line of the plan and all of the rest of us. So we could have really done a deeper dive into what self-insurance means. And we've learned from that. I think it's really important to get your data, to iterate, and to figure out, okay, what do we need to do differently? And that's where it comes back to, okay, we need to communicate much more frequently in smaller messages. Again, those digestible, little meaningful messages that are easy for them to understand that happen more frequently. And then it's not just, okay, open enrollment is your one time to hear about your benefits plans.
Great call out on educating and teaching about the bigger picture. The messages aren't just for the pre-deductible period. It is important to understand the bigger picture. That's a really good add on the communication side. So this is a final question for both of you before we jump into some of the audience questions. If you could recommend employers try one benefit design change, which one would you encourage them to start out with and why?
So I can kind of jump into this one first. So I would start with asking your team members what they want. I went back to what Jennifer was talking about earlier. We think sometimes that this is a great benefit. Let's add pet insurance, for example, right? That doesn't mean that's going to resonate with anybody. We actually did a survey and we asked our team members, would you like this benefit, right? So same thing goes with healthcare, right? We need to ask where people are at and what they're going to utilize. Do they see a benefit in this or not? I think that's really powerful. Our metrics can tell a story, but they don't tell the entire story. So I think in order to understand really your overall health and what your organization is hungry for, you need to look at the people component as well as the metrics. So I would recommend starting, I'm going to say it again, going back to the basics, right? Let's get good information in front of us so we can make even better decisions to move forward.
Great call out. A basic, but such an important reminder to just ask folks and listen to the data, whether it's from the employees or the numbers. Jennifer, what would you add?
Yeah, I would just add on to what Jamie said to reemphasize the importance of asking employees. That survey that we did through our broker was hugely helpful because that really allowed us to ask employees, what do you value as it relates to other benefits programs? So it told us, okay, our retirement plan contribution, for example, in our match, hugely valuable. So that told us we don't want to pull money from that to invest in a different program. It also told us that our employees really need to better understand certain benefits in order to better utilize them. So that gave us a huge amount of education. Speaking of that educational component, I really believe that care navigation tool is critical. And if you already have that in place, great. Tie some incentives to that. And I did see a question in the chat. We work with our broker to ensure that we are adhering to the regulations for the way that we give those incentives back to employees, because of course that is definitely very important. And I think our employees, they are very open to learning how to do something differently, but you have to give them the appropriate tools for it. And so that is an excellent tool to help them shop better. It's like we're sort of asking them to go to Target and pick out the cheapest thing, and there are no prices on the shelves. So you have to introduce them to a tool that gives them those prices.
Great call out. As we dive into the audience questions, I want to provide a quick recap of the top 3 things that we learned from today's program. Here's what we know and have found so far that works. Here's what we're hearing. Small changes in plan design can make a big difference. Removing barriers is key, and those benefit design changes support removing those barriers. Of course, analyze your data. It tells you where to start. It If you'd like help, of course, our team can always support you with reviewing your data, but start there, whether it's from your employees or what the numbers are saying. And if you have the ability, there's a right time and right place for using a pilot program. It's low risk. It's a high reward way to test things out. And of course, you can adjust it before you expand. It is progress, not perfection. Change doesn't happen overnight. So as we mentioned in today's session, we're calling this year's webinar series A Movement to Bend the Trend. It's what we're focusing on in 2026, and we're inviting you to be part of the movement. As you register for this session, our last session, and our next, you're automatically part of that movement. But of course, movements don't progress forward unless we all take action. So what I'd like to know is how you plan to take action after today's session. So let's take one more quick poll to find out what's one small thing that you will try before our next session. Here were some suggestions that we had. Begin with a data analysis, simplify a single benefit message, pilot a small design change or communication change, or maybe you're not sure. You would like help with the next step or something else. Share your feedback in the chat. There's been great comments throughout our session today. If there are any questions in advance that you'd like to submit into the poll, into the chat while we're waiting for the poll results to come back, feel free to add those questions in there. And while we're waiting for the poll results to come back, it's a big commitment to ask what you're willing to do before the next session. Appreciate the engagement. All right. Top two, we're looking at simplifying one benefit message, which is so in line with the suggestions that we heard today. If you would like us to either support with the message, offer support with the messaging or connect you with any of the ideas heard today, we can definitely do that. And this webinar will be available later if you want to circle back on anything you heard and you weren't jotting down notes fast enough. So this is a great start. We have so many of you committed to next actions. Again, each topic we cover this year is designed to help us all lower our benefit costs and bend the trend. We are building towards the bigger picture, and we can't wait to share how it all connects when we meet in person at our spring symposium. With that said, be sure to register for our spring symposium to be part of that connection point in this journey. So we did save enough time for questions. Thank you to everyone that took time in advance to submit your questions early. If there's something specific that resonated with you today, go ahead and post those in the chat and comments. I'll start with one of the first ones that we received in advance. So Barry says, high deductible health plans have run their course. Is there anything new and different on the horizon? I would ask Jennifer and Jamie, what are your thoughts on that?
Sure. So I'll go ahead and get started. We do still offer a high deductible plan as well as that copay plan, which I mentioned earlier. So I don't believe that high deductible plans have run their course. When we introduced the copay plan, like I'd mentioned, we didn't have huge migration over to that. And that was because employees really did value and see the value in that HSA contribution, but also just in the savings vehicle that the HSA offers. That said, I do think there was a fundamental flaw with high deductible plans from the get-go because it presumed a certain level of consumerism that employees could not take advantage of because they didn't have the data. So that is where pairing it now with the care navigation tool to be able to give them that data and help them make informed choices, that's where it's really important. So I still personally believe that the high deductible plan and the HSAs have a good long life ahead of them. That said, I think that seeing more and more about ICHRAs, direct primary care is another way to expand access to care. That's what we see on the horizon, and we're already starting to ask our employees about their feelings and potential current usage of DPCs, for example, to be able to see what they're experiencing. And we're keeping that as part of our 3-year strategy to see, what makes sense to introduce over time.
Great call out. I think the introduction of the high deductible health plan, we assumed that this financial investment by employees automatically translated to behavior change. But I think the majority of us underestimated how important it was to get those tools and in front of individuals. There just wasn't awareness of, they had never been expected to shop or look around for services. I don't think it crossed many folks' mind. There was a significant behavior barrier behind that. So thank you for sharing that example. Jamie, is there anything that you want to add before I move to the next question?
Yeah, I mean, I'm just going to echo what Jennifer said. I mean, we still offer a high deductible health plan as well. I think that there is, I mean, it all comes down to education again. I think it's really understanding that here's how this differs from this plan. So we actually have our total rewards supervisor sits down one-on-one with every new team member that's coming in, and she explains the differences of the 3 health plans that we have so they understand the benefit. So like Jennifer, I still think there's room for a high deductible health plan. I think it just comes down to education.
Sure. I'm hearing you both say that you offer more than one health insurance plan design, which leads to the next question. Before we jump into that, the last part of Barry's comment was, is there anything new and different on the horizon? And I've heard it come up throughout our conversation today. The concept of direct primary care, or Jamie, in your case, the on-site near-site clinic, it is offering a benefit for employees to manage their health up front. So while offering many benefit plan designs give employees choice, and that is a benefit in and of itself, there is a focus on making sure that upfront, the lower hanging fruit, people are managing their health early and often through those different channels. Many of our employer members use direct primary care or some variation of it. Feel free to reach out to your Alliance team if you have questions and that's something that you would like to talk about further. Moving into our next question, as I mentioned, Jane asked us, what do I need to know about offering more than one health insurance policy to employees? Is there anything specific you do to help compare and contrast and support employees through that part of the choice process?
Sure, I can kind of start with that one. What I would say is don't become overwhelmed. I think that sometimes I've been a part of employers that have done 5 different plans. That's far too much. If we can't remember them as the administrators of the plan and what the differences are between them, it's going to be very difficult for our team members to do that. So I would just encourage to keep it minimal. Our company, for example, has 3 different plans, and even that can get cumbersome at times. So I would just encourage that when you're looking at adding different plans we want to give variety, because we said it earlier in the webinar, people like choices, right? So having that team member has a choice helps them feel powerful, into getting really involved and engaged in their own health. So offering a choice, but yet keeping it manageable administratively, I guess, is a balance that each organization faces. But I would recommend don't go crazy and add 15 plan designs, because that's going to be very difficult to manage.
Great suggestions. Jennifer, is there anything that you would add? I know you have mentioned your multiple plan designs as well.
Yeah, I agree with what Jamie said. Choice is key and education is key. For us, we don't have an HR presence at the vast majority of our locations. So we are relying upon communication, whether it's via email, intranet, screens, home mailings. And I think that's kind of what scares me about ICHRAs, is just the breadth of choice, and we wouldn't have the insight to be able to best support our employees with that much choice out there. That said, we're staying open, and we will learn over time as these tools are introduced and see what the adoption is. But I do think it's really important just to support our employees through their questions and be able to help them navigate as much as possible. And I know there are tools out there like Jellyvision, for example, where you can help employees make decisions like that for themselves. So whatever you and your org have the budget and the willingness to be able to support, to connect your employees through navigating the complexity of healthcare, that's important.
Great call out. And your mention of supporting employees. I love that you're paying attention to your employee experience with all of the different options and thinking about the long-term plan. Stay open, but understand what their experience is as part of your decision-making process. That's a great consideration for folks. Tom wants to know, what's the best way to communicate with employee groups that are hard to reach, like warehouse employees, remote staff, and shift workers?
So I don't think there is a best spot. I think that you have to have multiple mediums, right? So it's not just a one-stop shop. I think you do have to meet people where they're at. And it's part of the conversation. So for us, example, we have an HRIS system that we can send mass messages to all of our team members. One of the opportunities with that system is it also emails all of our 150 team members that have email. So I get that, well, we're getting too many communications, right? So then the conversation is, hey, but we have to remember that our team members that work in the middle of the night only have access to this tool, right? So I think for me, I don't think that there's one medium. I think it's a multi-medium approach. For us, we do have digital bulletin boards in the break rooms. Much like Jennifer, we have the TVs that are out that tell the messages. We do have our HRIS system that we post messages to. We have email messages, we have social media, all sorts of things to help get the word out. But really, it's finding what style works for your workforce. I mean, every style is going to be a little bit different, and what works well in one location may not work the best in the next. So I'm going to go back to the ask your team members, how do they like to be communicated to, and what do they need to know in that communication? So to me, it's all about, again, asking the question.
Those are such great examples. We consider pilot to be so formal, but it's really trying all of those different channels with each audience and seeing what works and adjusting from there. It is progress, not perfection. Jennifer, are there any other things that you've learned over the years and how to communicate to the various groups? You have a diverse group as well.
We do, yeah. And I would say, I mean, Jamie said everything I would say. I always think about communication strategies for benefits as the same as that movie title from a year or two ago, Everything Everywhere All at Once, something like that. Understanding that you've got to push your communications out via multiple channels. Some employees might chafe at it being too much, and that's going to be the best way to reach everyone where they are and in their preferred way, but also change. If you're able to send out mailings that have a tracking mechanism, and you see, for example, that was really well adopted, excellent. Do more of that, maybe pull back in a different way, something along those lines. So it's a matter of always doing everything you can and then learning from that.
These are such great insights. From the questions that I'm seeing in the chat, we did have a request for sharing the survey questions. And Jennifer or Jamie, would either of you be willing to share those with our team and we can get that out to the group or those that were interested from our call today?
Yeah, I can do that.
I'm happy to. Oh, sorry. I'm happy to jump in really quickly. I can't quote it exactly, but the real value that we saw in our benefits survey was an understanding the relative value that people place on our benefits. So it was something along the lines of, would you be willing to pay 1% more in your benefits if you got 2% more of a retirement plan match? Something like that. That math may or may not make sense, but you get the point. It really helped us to understand that if we were to back away and pull something away from one benefit program that our employees really highly valued, that we would have a big disruption and it would not be the direction that we wanted to head in. And we had a whole series of survey questions about that relative value that pulled in everything from paid time off to our benefit programs to our retirement plan.
What a great call out, the relative value. That's one that is less common from an employee survey perspective. So great insights. Jamie, is there anything that you want to add? I know we were just asking about the questions, but if there's anything you want to jump in.
No, yes, absolutely. I'll provide our questions. Ours are much more broad. So it'll be interesting to see the compare and contrast of the questions. So I'm excited to see Jennifer's as well. So.
Absolutely. That's the benefit of the cooperative and this webinar series. So thank you so much. That wraps up today's events. I have a few housekeeping items to go through. I want to thank our panelists for joining us today. Jennifer and Jamie, thank you so much. It is so helpful to get the perspective of you doing the work on the day-to-day that are connecting with staff and getting this feedback and have been through what works and what doesn't. So the in-depth knowledge that you've shared is so invaluable. Thank you so much. We will, if you want to connect with your Alliance team member on any of the content that we discussed or the survey questions, please reach out to your account executive. Of course, if you're not a member of the Alliance and you're interested, you can click on the QR code or the contact us link in your resources box. And if you're watching this webinar live, you can claim CE credits by clicking on the SHRM or HRCI links at the top right-hand corner of your screen. Wisconsin brokers, remember to sign the attendance form via the link on the top of your screen if you have not already done that. CE credits can't be awarded without that, so that's critically important for that component. And finally, we'd love to see you at our next webinar and our upcoming in-person event. You can get all the details about both of those things on our events page. And of course, follow us on LinkedIn. All of these links are in the resource box. Thank you again for your time today, for your great engagement. And remember, when you think of the Alliance, think of self-funding, smart, and pushing our industry forward. Take care.